I will be talking about classification of wounds and character and what to proceed with. So we have three main characters regarding wound. You have localization, character, and time. So character and time walk together. Regarding localization, we have the patient here in which his localization of his wound was in the left upper third part of the calf, in the anterior medial part of the leg of the calf. And then you have character. So character, for example, you could have laceration, incision. The wound can be intention or non-intention, and it can be tidy or untidy. So regarding laceration or incision and other types is how the wound was made, regarding how the cut, for example, was made. So in the case of this patient, we chose that he suffered an accident, for example, and there was laceration, which means that it was not clean, the cut. And incision is mostly medical, which means that the cut is very clean and precise. Regarding intention and unintention, is rather it was already chosen to happen. So when you're in the medical field, you choose to have incisions because the patient need surgical precisions. When it's unintention, usually the patient come as in an emergency because he unintentionally suffered a laceration, for example, in the leg. And regarding it being untidy or tidy is if there is infection or presence of bacteria or dirt. So if it's untidy, it means that it can be contaminated with dirt, saliva, anything that might have bacteria and cause inflammation or infection. And if it's tidy, which usually happens in a medical, it is a clean wound. And then you have time. So time and character, especially tidy and tidying, walk together. So the time, if it's less than 6 hours, it will be, if it's especially medical, it can be tidy if it was not contaminated. And even though it's tidy and has more than 6 hours, it will be untidy because then we'll have enough time for proliferation of bacteria and microorganisms in the skin, especially Streptococcus. And then regarding treatment, which will happen further on, you have